Suicide Among African Americans by Jasmine Thomas. Suicide. Suicide is defined as the act of intentionally causing one's own death. Suicide is often the outcome of untreated risk factors. Although suicide itself cannot be diagnosed, there are warning signs and mental health disorders that can be treated to prevent suicide attempts. The most common symptoms of someone attempting suicide are mental health disorders, which are diagnosed by a mental health practitioner, as well as a family history of suicide, feelings of aloneness, and alcohol and drug abuse. The American Foundation for Suicide Prevention states that in 2013, 41,149 suicides were reported, making suicide the 10th leading cause of death for Americans. In 2013, suicide was the second leading cause of death among 15 to 29-year-olds. Suicide rates dropped from 12.5 to 10.4 between the years of 1986 to 2000. However, over the next 12 years, suicide rates increased to 12.6 deaths per 100,000. For African Americans, suicide rates were 5.4 deaths per 100,000 in 2013, with blacks only accounting for 15.2% of the population in the United States. Suicidal behaviors in the African American community, Crosby and Malik. Historically, suicidal behaviors among African Americans have been highly ignored because of the misnomer that very few African Americans completed suicide. It was also assumed that African Americans did not experience depression. This was because blacks were historically viewed as a psychologically unsophisticated race that were naturally high-spirited and unburdened with a sense of responsibility. The purpose of Crosby and Malik's study was to examine suicidal behaviors in the African American community. After review of several research studies conducted, they found that the most common risk factors for suicide in African Americans included substance abuse, feelings of hopelessness, and stigma surrounding seeking psychological help. African American males, Ward and Collins. The purpose of this 2010 study conducted by Ward and Collins was to determine the risk factors of depression in a group of African American males. What they found is that stressors including racism and discrimination, educational attainment, occupational status, income, and poverty all contributed to depression in African American males, which, if left untreated, increased the likelihood of suicide completion. They also found that, although African American men suffered from rather higher rates of depression, their psychological utilization was very low. This can be contributed to the lack of access to a competent therapist, transportation issues, especially for those who are living in poverty, and lack of funds or medical care. Factors for suicide attempts among African American women, Caslow et al. In the 2000 study conducted by Caslow et al., they sought to understand the risk factors associated in low-income African American women. What they found is that several psychological and interpersonal variables served as risk factors for suicide attempts in these women, such as mental health disorders, physical illness, PTSD, hopelessness, drug abuse, relationship discord, stress, childhood trauma and family history, and social support. These results that show these high-level risk factors in low-income African American women should be used in conjunction with appropriate individualized mental health care. It is important to note also that the correlates relating to suicide differ very much between black men and black women. Web of causation. On this, there are 8 correlates that correlate directly or indirectly with suicide, beginning with mental health disorders such as depression, anxiety, schizophrenia, bipolar, a lack of access to treatment such as transportation, impoverished areas or lack of medical care, physical illness, a family history, whether a traumatic childhood or family attempts of suicide, stress, such as low-level racism, monetary stresses, relational stress, help-seeking stigma, with the fear of being labeled or the lack of family support, low socioeconomic status, low to no education, or not enough funds to pay for help, and finally, substance and alcohol abuse. African American social work perspective. Social work research on African Americans and suicidal behavior, a systematic 25-year review. Social workers, one of the largest groups of clinicians to deal with mentally ill populations, have the opportunity to engage and identify ways in which to decrease the number of those who commit suicide. As the number of African Americans who commit suicide increases, there is a need for culturally competent mental health clinicians, as well as a breadth of empirical research needed so that mental health professionals alike can contribute to the proper treatment of mental health disorders that lead to suicide. As there is not much literature that has been identified, it is critical that those in clinical and non-clinical settings, whether African American or European, understand the cultural risk factors of suicide associated with African Americans. Mental health in the African American community, MHIAAC. Mental health in the African American community is a not-for-profit grassroots organization targeting African Americans suffering from mental health issues. They also aim to identify and implement approaches that can be used to overcome sociocultural stigma that is pervasive in the African American community concerning mental illness. The goals of MHIAAC are to reduce mental health and emotional suffering in African Americans by increasing the knowledge of mental health disorders in families, support groups, and primary care physicians. MHIAAC connects those in need of mental health treatment to particular services. They educate African Americans and those who are in place to help these individuals about the early warning signs of mental illness. Because MHIAAC is relatively new, they have not been tested for effectiveness. However, they are currently participating in educational seminars throughout Georgia and mental health awareness conventions in Florida. Laura's Law is a process that allows courts to compel individuals with severe mental illness and a past history of arrest or violence to stay in treatment as a condition for living in the community. Equally important, it commits the mental health system to providing the treatment. The policy targets those who have serious mental health issues and have been repeat offenders in the court systems. In 2014, Nevada County implemented Laura's Law and found the results on the right-hand side. There was a reduction in every area, including hospitalization, incarceration, homelessness, and emergency contact. $1.81 to $2.52 was saved for every dollar spent as a result of reducing incarceration, arrest, and hospitalization under Laura's Law. Policy and has been deemed effective for those in which it was intended for. Making it a mandate for those suffering from mental health issues to seek treatment in order to be integrated back into society is a good way to track mental health behaviors and assess the effectiveness of seeking treatment. By implementing this into law, people have a second chance and a lower chance of committing suicide. However, its one weakness is that those who benefit from this policy are only those who have had prior interactions with the court system. It does not target those who are fully functioning and suffering from mental illness. Suicide is one of the leading causes of death among Americans, even more than homicide. Suicide among African Americans has increased in the last 3 years, and it is a problem that requires the attention of policymakers and grassroots organizations. Conversations surrounding suicide and mental health disorders are imperative in the African American community as it is often stigmatized. An increase in protective factors, such as lowering stress, positive family support, and a decrease in risk factors is necessary to prevent the number of deaths by suicide. With an increase in critical discourse, organizations have acknowledged the rise in suicidal behavior and have answered accordingly. However, it is imperative for more research to be conducted on African American populations to ensure suicide rates decrease. Thank you for listening. Again, my name is Jasmine Thomas.